you or any member of your extended family ever been uninsured?
Yes, we have. I think I have for short periods of time, and we probably still have members of the family that are adult and they're young and they're
And without
healthy and
insurance?
they don't work for a company that has it, so they're without it. But I'm in the process of why am I not helping them and encouraging them? Because for about $100 a month, you can get a major medical policy. Major medical insurance, which is true insurance, is not that expensive, and it's when you pay for the first dollar of service when it becomes so expensive. What we have today is not insurance. If you get a policy and they pay your first dollar, you're getting some type of a service prepaid. And that's quite different than if you insure against a major illness or an accident. That way you can measure it and the price goes down. But if it says, well, every time you have a sore throat and you might go to the emergency room, you're insured, I mean, this makes costs skyrocket. So we've lost the principle of insurance in the system that we have today, and it has to do with our tax code and various things like that.
And one last question on this subject of access and coverage. You had mentioned earlier about health savings accounts, and I presume that you see that as a vehicle for the working poor who are uninsured.
Good transition.
But we've taken a survey where we found that a family with an annual income of $25,000 would have to devote 13% of their annual budget just for premiums alone. So does that sound like an affordable scenario?
Yeah, but I would challenge you on that.
Okay.
Because that's the insurance that we think of insurance so that they can get, $5 copay and they can go see the doctor. That's not insurance. But probably for $1,200, they could be insured for major medical, the real catastrophic illnesses, and then they can save up and pay and take care of the first $500 or so. Or corporations, because the company they work for have been devising that. They are moving this direction where the company itself encourages this because there's an incentive not to spend the money, because you get to keep the $500, if you don't use it, or whatever the company provides or your medical savings account provides. So yes, it's very, very expensive to have this medical coverage, but that is not exactly an insurance premium.
Let's talk about a couple of other areas involved in healthcare policy. If a Katrina type disaster were to happen on your watch, how would you handle it differently than the administration did, so that we wouldn't see the kinds of pictures we did out of New Orleans and wouldn't have the kind of experiences that people even to this day in New Orleans are experiencing?
Of course, there's two parts of that question. One is in the ideal society where you have individual freedom, personal responsibility, and states' rights. This would be a state function. All the money would have stayed there, and you wouldn't have had central economic planning, because it doesn't work.
Okay.
And Katrina proves it. So it proves my point that it's a lot of wasted money. They gave out $500 million to people who weren't even, suffering, and they weren't even in the flood area. They bought trailers by the hundreds that never got used. So this is a proof that central economic planning doesn't work. When Galveston had their disaster in 1900, they rebuilt, and they have a seawall, and that's in my district, and they didn't have a federal government approach. But once again, the transition, we exist, that's the law of the land, the money's been taken away from the states. What you have to do is get the best management. I try my best. I never spend a penny of Social Security, although I see a better system. So I protect it. So I would have to have the right kind of people to manage. But the emphasis would be different. I'd want local people to be in charge. I don't want the federal government to go down and be in charge and take over and kick out. We had more complaints when we have floods in our district about FEMA, because the Red Cross can't come in, the landowners can't come in. Somebody proposes, like in Louisiana, that if you want to protect your property, they kick you out and they take your guns. And I would want the local people to be in charge and work with them to be available to them and make the services available. I certainly wouldn't have the Air National Guard or the Army National Guard in Iraq. I'd have it available to to the governor so that they can use it. So it's a whole philosophy that you have to look at in order to come up with a solution. But the responsibility of the president would be have the most efficient people that can make that work and utilize local control and local knowledge, rather than thinking there's one person in Washington that has all this knowledge and you can do it through central economic planning.
Final question. I think Americans like to have a sense of the priorities of a candidate. And as we talked before we started taping, in this presidential candidacy of yours, you're relying very heavily on the internet. I've seen YouTube videos of you as well. And on your website, there's very little mention of healthcare policy specifically. So what does that say about where this falls in your list of priorities?
You know, I think it's a good point and worth criticism, because I think we're short on that.
I'm not really criticizing, I'm just making an observation and asking for an
explanation. I think we probably will and should, do that, because it is an important issue. But I imagine that foreign policy has been a major driving force for me, because that is the top issue. And secondarily, I've been very much involved in economic policy and deficits financing and monetary policy, which incorporates all these things, because deficits cause inflation, inflation causes hardship to so many people and unemployment and this sort of thing. So if you're spending too much overseas or spending too much on medical care, this contributes to that economic problem that I see. But yes, I think as the campaign goes along, we'll have more specific, not only on medical care, but on other issues as well, where we will have a prescribed policy. And unfortunately, even in the debates, it hasn't come up very much. It came up one time in all our debates, and you'd think I could have gotten the question, but I wasn't. I kept, trying to get the attention of the moderator.
It's hard to be heard in such a large group.
Yeah. So, but I'm delighted that you have a program like this that gives us a chance to explain our position. So I'm very pleased that I've been able to talk with you on this subject.
Well, we're grateful you came in. Thank you very much, Congressman.
Thank you.